Today we will be talking about the incorporation of technology into the workplace. Since the beginning of the COVID-19 pandemic, telehealth has been implemented within the healthcare world and is becoming more prevalent. So what exactly is telehealth? Telehealth is defined as the use of electronic information and telecommunication strategies to support long-distance clinical healthcare and patient and professional health-related education. Technologies used for telehealth include video conferences, imaging, streaming media, and wireless communications. Telehealth is different from telemedicine in that telemedicine is specifically referring to remote clinical services, whereas telehealth refers to non-clinical services such as provider training, meetings, and medical education. Utilization of this technology can make diabetes care even easier. It can increase access to diabetes care and education between healthcare visits. Technology support between visits include apps, devices such as a continuous glucose monitor and an insulin pump, and education. With this widespread use in technology, diabetes care and education can establish a technology-enabled practice which can improve clinical outcomes. Cloud-based data sharing platforms are replacing manual processes of uploading data to a computer. Medical records may also be available to the patient and clinician on these clouds, which decreases costs associated with paper records and provides an increased accessibility to patients for their data. It also saves time when accessing these records. Not to mention that these cloud services offer better security and privacy for both the patient and clinician. Technology allows for fewer office visits, which frees up the healthcare team and can decrease the crowds at the healthcare facilities, which results in lower infection rates among the population. It also makes healthcare more accessible to those who live in a more isolated or rural community. Telehealth also gives the patient more flexibility because more services are available to those who may have limited mobility, transportation, or time. On the clinician side, it improves communication among the healthcare team. Advances in technology empower those with diabetes to achieve self-management goals and decrease the psychological burden of living with diabetes. It also allows for the healthcare team to provide ongoing support to their clients. Mobile apps allow for the uploading of information such as glucose readings, so the healthcare team can monitor blood sugar readings remotely. The patient can also share this information with family and friends. Technology has the potential to improve the quality of healthcare and make it more accessible to more people. However, it also runs the risk of fragmenting healthcare. This means gaps in care, inappropriate use of medications, or unnecessary care. Telehealth services may also be limited by the ability to pay for them because insurance reimbursement varies widely from state to state and by the type of insurance. Other limits include internet availability and the cost of technology, such as a smartphone or a computer. Now, let's talk about managing diabetes and using telehealth. Over 29 million people suffer from diabetes, and those that live in a rural population tend to be more affected. The proper management of diabetes is critical to patient health. Technology has the potential to improve quality of care and increase access to healthcare services for those with type 2 diabetes. Lifestyle modifications help with the self-management of diabetes and can be monitored through a telehealth platform. A study of low-income adults living in a rural community with poorly controlled type 2 diabetes were divided into two groups. The control group received their usual care, and the intervention group received telehealth with nurse management care. The participants in both groups were asked to take daily blood glucose readings, and those in the telehealth group uploaded their information so that the nurse case manager could monitor the patients and adjust dosing of medication as needed. After 6 months, those in the telehealth group had lower hemoglobin A1C levels than those receiving their usual care. A greater adherence to therapy and improved communication between patients and providers was also seen in the intervention group. Telehealth improved patient adherence because the patients were more easily able to report their blood glucose readings and the nurse could respond to the patient's status in real time.